I believe in better, stronger Medicare for more. Today's Republican condemnation of Medicare for All continues a great Republican tradition of opposing Medicare for anyone. They use the same. We've heard this morning that it would be about the worst thing to happen to the world since plagues struck Egypt. I find this to be, though, the same worn-out rhetoric they have used through the years. When Franklin Delano Roosevelt proposed Social Security, the Republican chairman of this committee, as late as the 50s, was still saying that it was the lash of the dictator that would be felt. Another Republican said it would enslave workers. Another said it would pull the pillars of the temple down upon the heads of our descendants. And when Lyndon Johnson was able to get this Congress to set up Medicare, Ronald Reagan condemned it as socialism. Another Republican said it's not only socialism, it's brazen socialism. When we attempted to get a children's health insurance program through this Congress, now being relied upon by these folks, the Heritage Foundation said for Republicans, socialism hitching a ride on the backs of children. The Affordable Care Act was attacked by Republicans as the crown jewel of socialism. And of course, former Speaker Newt Gingrich, Mr. Let Medicare Wither on the Vine Gingrich, said you cannot get to universal coverage without a police state. All of this simply masks a Republican Party that, when it comes to health care, is intellectually bankrupt and is offering only nothing care. Medicare remains the bright spot today in our healthcare system despite Republican efforts to undermine it. It provides seniors with cost-effective health coverage that they can always count on. And I know many people around this country that would love to participate in Medicare. They're just not old enough. To be sure, Medicare has some gaps. That's why I've introduced separate legislation to expand to include dental, vision, and hearing, and legislation to make sure that Medicare plans, Medigap plans cannot deny coverage to seniors with pre-existing conditions. And it's why I focused on prescription price gouging. But Medicare for All would resolve all of these issues. I support it not because it's perfect, not because it doesn't need further refinement, but because it represents real progress in presenting a bold idea to address the shortcomings in our system. Democrats have offered, in fact, a number of good proposals. I salute Congresswoman Jayapal for her work on Medicare for All, the work of Congresswomen DeLauro and Schakowsky for Medicare for America, and of our colleague, Mr. Higgins, on the Medicare buy-in proposal. These are different approaches, but this will not be a program that gets implemented overnight. There is, as with any major reform, it will have to be phased in. It represents what we need to do to move our country forward for this basic right. I'm pleased that the Medicare for All and the Medicare for America bills incorporate verbatim the text of the Medicare Negotiation and Competitive Licensing Act that I've introduced to deal with prescription price gouging and monopoly prescription drugs. I salute the efforts of Public Citizen to support Medicare for All and would ask unanimous consent to include their statement in the record, Mr. Chairman.
So ordered.
And would also honor the good work of the National Nurses United, particularly Gene Ross and Bonnie Castillo. Dr. Berwick, you have indicated that we need Medicare prescription drug negotiation, and you've heard reference this morning, and of course Big Pharma always claims that if we make drugs affordable, innovation will be stifled and Americans will not be able to access the drugs they need to cure the diseases we want cured. What do you think of that argument?
Well, we need to defend the interests of patients, and the interests of patients include the excess costs of drugs today. We need a powerful negotiating advocate for patients on the other side of the table. We don't have that right now, and so the drug prices are rising insanely, denying people access to drugs. We absolutely need to preserve innovation in this country. We need to invest in it. A lot of the innovation is coming right now. The drug companies are exploiting is public investment already from National Institutes of Health. They spend more money on advertising than they do on research. But I want a healthy research effort in the drug industry. We have to make sure that's preserved. But I do not believe it's preserved by having these confiscatory drug prices. We need negotiation on the other side of the table.
Thank you.